Hello everyone, my name is Katherin Mendoza and today we'll be discussing a perplexing medical case involving potential metabolic and renal abnormalities. The clinical test results before us encompasses a wide range of measurements including protein, specific gravity, pH ions, urine observation, ketones, etc. These metrics collectively shed light on the patient's blood glucose level, kidney function, metabolic state, and the potential presence of other substances in the urine. The patient I will be discussing is a 25-year-old African-American female complaining of tiredness and increased urination, presented with swelling of both legs and feet. Her blood pressure at the time of intake was 185/95, indicating hypertension. Her chart indicates she is 5 feet 2 inches tall and weighs 120 pounds. Upon close examination of the patient's history, several noteworthy aspects come to the forefront. Firstly, the blood glucose level registered at 120 mgs indicates an elevated but not critically high level. This could be indicative of compromised glucose metabolism, perhaps hinting at diabetes mellitus. The presence of glucose in the urine, as detected by both the Benedict reagent and the reagent strips, further reinforces my suspicion. Additionally, the specific gravity of 1.002 is slightly below the normal range of 1.005 through 1.030, raises a concern about kidney function. This could signal impaired renal concentration ability or even things like chronic kidney disease. The appearance of a cloudy white precipitate during protein testing points to proteinuria, a potential sign of kidney dysfunction or damage. This is significant since healthy kidney typically filters out protein molecules. Interestingly, the absence of precipitates in the ketone test and the lack of pink color in the urobilinogen test suggests relative stability in the patient's metabolic state, possibly excluding certain liver or metabolic disorder. The pH level, which is 6.0 in the urine, while likely within the normal range, would need further evaluation. Meanwhile, the absence of ion points to the absence of several electrolyte imbalances during testing. Taking all these factors into account, my hypothesis is that the patient might be grappling with an uncontrolled diabetes mellitus, possibly of the type 2 variant. This could explain the elevated glucose levels and the presence of glucose in the urine, along with the potential kidney involvement through proteinuria. Diabetic neuropathy, a common complication of diabetes, could be a contributing factor to these kidney dysfunction. Some tests that we can run include hemoglobin A1C for assessing long-term glucose control and imaging to evaluate kidney structure and function will be crucial in achieving a more definite diagnosis and a well-informed management plan for the patient. Here you can see the data that has been collected. To go in depth, the chart, the graph and value for the CK levels presented in the patient is in normal range. As for the LD levels presented in the patients fall below normal range. As I stated previously, the patient's primary complaints were tiredness, increased urination, and swelling of the legs and feet. To begin with, her blood pressure was found to be high. So with that being said, the first test is the glucose meter reading on her blood, which showed a reading of 120 mgs. This indicates slightly elevated blood sugar levels. The elevated blood glucose could suggest the presence of diabetes or impaired glucose tolerance, which could be contributing to her symptoms. Moving on, we have 2 urine tests for glucose, one using the Benedict reagent and the other one using the strips. Both tests revealed the presence of the glucose in her urine, indicated by the color changes of acid green, army green, brown. The Benedict reagent and the reagent strips contain chemicals that react with the glucose, producing the color change. This consistent finding of glucose in the urine strengthens my suspicion of diabetes as a possible cause. Next, her protein test showed a cloudy white precipitate of formation indicating proteinuria of the presence of excess protein in the urine. This might point towards kidney dysfunction, which is associated with the conditions like hypertension and diabetes. The specific gravity of her urine was measured at 1.002, which is lower than usual and suggests dilute urine. Impaired kidney functions could explain this finding. Her pH value was measured at 6.0, which indicates a slightly acidic urine. While this information might seem minor, it provides insights into the metabolic process and renal function. Additionally, the observation of her urine being medium yellow color is within the normal range, reflecting factors such as hydration and diet. Tests for the ketones and the urobilogens both came back negative, indicating no presence of indicating no abnormal color changes in the test. These results are important as the absence of ketones is reassuring. And urobilogens. Findings suggest no significant liver dysfunction or excessive red blood cells breakdown. Lastly, her CK level was within the normal range, indicating no ongoing muscle damage, while her LD level was below normal range. These results need further interpretation in the context of her overall clinical presentation. These tests collectively provide valuable insights into the patient's health. The elevated blood glucose and glucose in the urine combined with the proteinuria and the low specific gravity suggest the possibility of diabetes and kidney dysfunction. These findings aligned with her symptoms of tiredness, increased urination, and swelling. Moving on, I'll be evaluating the results. As I mentioned before, the patient's blood glucose level was at 120. Additionally, the urine test using the reagents, the strips and the Benedicts, showed acid green and brown. All of this suggesting that the presence of glucose in the urine. For the muscle and organ health, the CK level was within normal range, indicating no muscle damage. However, the LD was below normal range, which might suggest some impairment in the tissue function or metabolism. As for the kidney function, the presence of a cloudy white precipitate during the protein test indicates proteinuria, which can be known as kidney dysfunction. A low specific gravity coupled with the pH of 6.0 and the absence of ions might suggest impaired kidney concentration ability, potentially due to the elevated blood pressure. As for the urine properties, the urine appeared medium yellow, which is usually normal. There was no indication of ketones or urobilogens. Based on these findings, the patient's symptoms, and the clinical data, we can infer that this individual is likely experiencing multiple issues. The elevated blood pressure, proteinuria, all suggest potential kidney involvement, possibly due to hypertensive neuropathy. The presence of glucose in the urine may indicate diabetes or impaired glucose intolerance. The LD levels below normal range might hint at tissue damage or metabolism issues. However, it's essential to further investigate the patient's medical history, family history, and possibly conduct additional tests like renal function panel, diabetes screening, and lipid profile to get a more comprehensive understanding of her condition. Examining the clinical results, we find that her blood glucose levels, both in blood and urine, are elevated. The urine glucose tests indicate a disconcerting presence of glucose, suggesting that her body might be struggling to regulate the blood sugar. The appearance of a cloudy white precipitate upon testing for protein in the urine indicate a potential problem with kidney function, as protein should typically remain in the blood and not leak in the urine. This, coupled with low specific gravity, pH of 6.0, absence of ions, and the medium yellow color of her urine, may point towards a condition involving impaired kidney filtration. Some potential disorders include type 2 diabetes, diabetic neuropathy, polycystic ovary syndrome, and kidney disease. Interestingly, there are no indication of ketones or urobilogens in the urine, which rule out certain liver and metabolic disorders. Taking all these factors into account, it becomes clear that we're dealing with a complex case that aligns with the symptoms and clinical findings of the condition known as diabetic neuropathy. This is a kidney-related complication of diabetes, where elevated blood sugar levels over time damage the delicate filtering system of kidneys, leading to proteinuria. The swelling in her legs and feet could be due to the fluid retention commonly observed in kidney-related issues. After analyzing the patient's system and the clinical test results, we can confidently diagnose her with diabetic neuropathy. It is important to highlight that the case undergoes interconnectedness of various physiological systems and significance of early intervention and management diabetes to prevent such complications. Now that we have arrived at a diagnosis of diabetic neuropathy for our patient, we can discuss a treatment plan that aims to manage her condition and improve her overall quality of life. Starting off with the blood glucose management. The cornerstone of treating a diabetic neuropathy is a tight blood glucose control. Collaborating closely with our patient, we need to develop a personalized diabetes management plan. This may involve the combination of dietary adjustments, regular physical activity, and potential medication or insulin therapy to keep her blood sugar levels within a healthy range, as well as blood pressure control. Given her high blood pressure levels, blood pressure management is very crucial. Lifestyle modification and as well as a low sodium diet is important. Medications such as ACE inhibitors may be prescribed to help protect her kidneys and manage blood pressure. Kidney health is also very important. Preserving kidney function is paramount. Our patients should be receiving regular medical checkups, including monitoring of the kidney functions through blood tests and assessing the GFRs. Protein restriction is also important to alleviate strain on her kidneys. Reducing protein intake might be recommended. A dietitian can guide her into crafting a balanced diet that meets her nutritional needs while safeguarding kidney health. Medication management is also important. Some medication might contribute to kidney problems should be used cautiously. Dosages and types of medication might need to be adjusted to ensure they don't compromise kidney function. Maintaining an appropriate fluid balance is also vital. This can help prevent fluid retention and related complication. Lastly, lifestyle modification as limiting alcohol consumption and achieving and maintaining a healthy weight are all important lifestyle factors that can possibly impact her condition. Regular follow-ups and educating the patient is very important. Diabetes education sessions can empower her to make informed decisions about her health, understanding her medication, and effectively manage her condition. A collaborative approach involving a healthcare professional, the patient, and her support network will be crucial in achieving successful management of diabetic neuropathy. Overall, our patient's journey towards wellness requires dedication, discipline, and a supportive medical team. By adhering to this holistic treatment plan, she will work towards preserving a kidney function, managing her diabetes, and living a fulfilling lifestyle.